This is CareShift with me, Safik Bilikanti, and today I'm thrilled to welcome Allon Bloch, co-founder and CEO of K-Health. K-Health is revolutionizing primary care with clinical AI that delivers 24/7 virtual access to affordable, high-quality care. Using advanced AI for symptom analysis, personalized insights from millions of anonymized records, and direct connections to licensed clinicians, K-Health provides diagnosis, prescriptions, chronic care, and triage available via app or white label through partners like Cedars Sinai, Mayo Clinic, Hackensack Meridian Health, and many more. K-Health has raised over $439 million across multiple rounds and backed by amazing investors including Clark Group, Mangrove Capital Ventures, Valor Equity Partners, Bessemer Venture Partners, Comcast Ventures, and many more. Allon was amazing, and this was truly a great show. Allon, it's amazing to have you on the show, so thank you so much for being here today.
Thank you, Satvik. I'm excited to be on your show.
Well, I wanted to kind of dig into, as you know, primary care in the US is broken. I mean, we have long waits, high costs, massive burnout for physicians, nurse practitioners. Why is clinical AI and the concept of using AI in healthcare the biggest unlock right now? And what can that potentially look like in maybe 1 to 2 years?
There's like four questions around there. Let's start to unpack this. You're talking about a massive industry that's 1/5 of the American healthcare. Everybody knows it. Warren Buffett famously said that healthcare is a tapeworm eating the American economy because it's very inefficient, very expensive, but also the outcomes are not always as stellar, even though America has by far the best sophisticated healthcare for complex stuff like neurology, cardiology, oncology. There's just more money and more can do around kind of the really complex stuff. But from a population health perspective, it's really tough to do. Now, just to be very clear, Satvik, it's tough to do it anywhere in the world because this is a really, really important part of life. Your health, whether it's preventative, acute, or chronic, whether it's big or small. But being able to be in front of a doctor means being in front of somebody who's got 10 or 20 years of clinical experience. It costs a lot of money to get there. If you need a device, it's expensive. It's a medication. Somebody spent $1 billion to develop that medication. These things cost money. And in America specifically, you've got this tremendous complexity of a lot of chronic burden. People that are what's called polychronic. They have diabetes and hypertension. Maybe they've got thyroid issues. Maybe they've got heart issues. And so a lot of people in their 50s, 60s, and 70s have multiple polychronic conditions. They've got multiple issues. And then you're higher risk of everything. And then you need more doctors. You're more in front of primary care, more in front of ER, and more in front of specialists. And there's a back and forth. Bear in mind that it's not always easy to move people around. Somebody needs to go. They're not feeling well, or their blood pressure is high. Now you need to manage them. You need to titrate them. You need a medication. You need to follow up. All these things cost money. And so step one is just to realize just how complex it is. People think that doctors are gods, that they have the superior knowledge and they can open up the book of medicine and page 1,800, paragraph 2, there is Satvik, and he's the orange patient, and he needs the orange diagnosis with the orange treatment, and it's one and done, and he leaves the room. It doesn't work that way. It doesn't work that way because a lot of medicine is time-based. Maybe the symptoms haven't presented themselves. Maybe the symptoms nuanced. We don't fully understand everything about our genes or the connection to our mental well-being or the interplay between different background diseases. Drug-to-drug interactions is incredibly complex. So we don't have the answers to everything. And so, but people want to go in, have the answers, and want it to cost close to zero. So first of all, we need to, be realistic about what doctors can do and how much these things cost. That
Right.
said, the second word of AI is intelligence. Imagine if you can take AI agents and the same way that people use them for coding, you can now use them to be part of the care team. And that's what we built. And I'll stop here in a second, but what we built here is AI agents that are already orchestrating patients and moving them around the continuum of care. It's not just focusing on the front, on helping the doctors understand the triage, the potential diagnosis, the potential treatment, but it's also collecting information, pulling out your medical record. All these things are extremely time consuming, very tough to do well, and very tough to manage. So if you can take that and orchestrate it with a high quality and very trusted AI agents, you're changing the game. And that was the premise of why we started K. And now we have all these capabilities and experience to be able to do that.
Yeah, you brought up a lot of good points there. One thing that you mentioned was how making the technology is all about intelligence, and the intelligence is getting much more stronger than ever. One thing is that we're seeing a lot of commoditization in a lot of the AI primary care doctors. I mean, we see Doctronic, we see a lot of these new companies coming out saying an AI doctor in your pocket. How is going to be kind of substantially relatively big in the field compared to a lot of new startups coming in? And how can K kind of move on as we kind of progress with the new technology advancements happening?
When I went to business school, they spoke to me about a lot about competition and how to beat competition. My competition is inertia and status quo. And I encourage you and all your listeners to focus less on press releases and more on products. There's 0 products out now, 0, that have AI that's integrated as part of the health system to be part of the care team to help the doctor with the supporting them on the core of triage, diagnosis, and treatment. There's one thing to build something on the outside. You have wonderful frontier lab models, and they're getting better over time, and they're fantastic. And we certainly leverage them in different places. But you also need real data that's trained to practice what a best doctor in the world would do. And medicine is a lot of worlds. We focus on primary care, which is probably half the visits in America, and then on the population health aspects of navigating these patients. So there's one thing sitting on the side. Everybody can say doctor in the pocket. No, every VC can make claims that you don't need doctors and you can do it with AI. Let me ask you a question, Satvik, the other way around. Imagine if you went to a doctor and the doctor said, look, good news, bad news. 90% of the time, I'm really sophisticated. Talk to me in every language. I can understand all these different things. I'm going to give you a nuanced and granular answer. I'm going to be fantastic. 10% of the time, I'm senile. I'm hallucinating. I don't know, but I don't know that I don't know it. And you don't know that you don't know it because you're not a doctor either. Would you want to go to that doctor? So I'm just saying there is a difference between getting a lot of really helpful information to one of the frontier labs and understanding and integrating into healthcare. What question is a lifestyle question around your health, a preventative question, an acute issue, your head hurts, rash, stomachache, a refill, all these different things. There is a vast difference between what used to be Dr. Google and now it's AI LLMs and something that's integrated. It has your insurance. It has your medical records that connect the thing. And this is where a lot of people are confused. If you're, how old are you, Satvik, if you don't mind me asking?
25.
25. Magical age. You're 25. Most 25-year-olds are young and healthy. They don't have chronic conditions. They occasionally have acute issues. And so your medical background, unless there's some kind of complex family history or something like that, is pristine. You're coming there and you've got an acute issue, sore throat, let's fix the sore throat. You go home, maybe you need antibiotics, maybe not, no big deal. But our average patient that interacts with our AI and the doctor who's using us to take care of the patient, our average patient is 60. About 2/3 of the time female. She has 3 or 4 things going on from a background disease, diabetes, hypertension, thyroid, cancer, heart, you name it, taking 6 or 8, 10 different medications. There's always a need to adjust. Maybe they've started on a GLP, maybe the blood pressure medication's off, maybe the vitals off, maybe they've got symptoms. You need a health system, to be clear. That's not an urgent care problem. People go to the ER and urgent care for primary care. That's not where you need to go. You need a family medicine. You need access to this really high quality system. And then if the primary care can resolve it, great. If you need to be escalated to a specialist, a lab, a test, great. We can do it all within a health system. And we built this in a way that is all encompassing. And again, when you're 25, you say, why do people need hospitals? Why do they need doctors? I just occasionally need an urgent care doctors. And you're probably right when you're 25, but I promise you're wrong when you're 75 or 60. And of course, things people have in life, there's a lot of things people have, whether it's common conditions or rare diseases. So there's a vast gulf between, there's a saying, public relations is not press releases. You read a press release or somebody who copied and pasted a press release, there's 100 systems with doctors in the pocket. Most of these are certainly not even AI. Some of them are. But there is a vast difference between having that and building it as a trusted source. A major health system like Mayo Clinic or Mass General or Cedars Sinai, or a major community system that's taking care of millions of patients like Hartford HealthCare or Hackensack Meridian, just some of our partners. This is not like trivial stuff, and good luck breaking through this. So yeah, for a decade, I'm hearing about all these big companies. Look at Walgreens and CVS. Look at the big tech platforms. They all try to break through. I, yeah.
I was gonna say exactly that's exactly true, and I wanted to kind of deep dive into that because I wanted to really get into how K Health was before and now what it is after. Now we clearly see the big problem. A lot of patients are not really focused on the preventative health. A lot of them are focused on, I had a guest before. His name was Amit Garg, who was he was a founder of Ta Ventures, and he mentioned how we're kind of focusing a lot on sick care. That's where America is kind of headed towards and becoming. How can we kind of take the first step of, preventative? How can we get patients to be more proactive? And I know it's a hard question, but what is that?
Cedric, I'm gonna turn the tables on you. What baseline on your health do you have right now?
Uh,
Vitals, labs, what do you have?
as of now, I have everything. I have my vitals. I have
Okay.
my
Most of your friends don't have it, right?
yeah, most of my yeah. It's
Okay.
very hard to find.
How many people plan ahead 10, 15 years ahead of time to avoid diabetes and heart? Like when you're younger, people, you can eat junk food, you
Yeah.
can do whatever you want to your body. I think there's, of course, a movement towards fitness and health, that's getting much better. I find these things slogans. These slogans are not helpful. Everybody at their stage of life has something they need to prevent. When somebody had a heart attack, they have a much higher chance of a secondary heart attack. That secondary prevention is critical, and it has a huge ROI. When somebody's 80, they might want to say, look, even when I'm 90, I want to lift up my grandchildren. When somebody's 50, they might say, I want to run a marathon.
Yeah.
When somebody might be vegan and say, look, I want to make sure that all the vitamins and minerals and my markers are good. People have family history and say, look, how do I avoid? I've got a family history of cancer. You've got all these different things going on that is highly personalized.
Yeah.
That you have a lot of sick care
Yeah.
and you have a lot of current needs that people have that you can't ignore them. And that's most of the cost of healthcare. And yes, people absolutely need to do preventative care. But what people are also doing is they going and reading about various supplements that have not been tested necessarily. And, they read about it from some social media influencer. So I'm just saying, slogans aside, do you want to do preventative, acute, and chronic care? And the number one thing that people should focus on that's in their control, I'm talking about millions of people, so everybody personally might have a different family history or different medical history. The thing you want to focus on most of all is avoiding diabetes and heart-related stuff, because that's highly modifiable with lifestyle changes. That'll also impact everything else, including cancer. And when people, again, turn 40s and 50s, that's where they become pre-diabetic. It's not a rare disease. Pretty much everybody at 70, I think it's 90%, have elevated blood pressure. And elevated blood pressure is a high risk for everything. And diabetes, type 2 diabetes, is a high risk of everything. And these things, lifestyle is a big component. It's not the only component, it's a big component. So managing that, whether with lifestyle changes or therapeutics, is critical. In order to do that, you need intelligence. You need to be able to follow up with the patients. Those are the things we're building. So I think we need to be careful from slogans.
That's true. That's very true. And that kind of goes into another problem. And I'm curious how Kay is solving it is how patients are waiting weeks for a doctor. I mean, now we know that patients would rather just stay at home and text their best friend ChatGPT versus just going to the doctor and waiting and just going through all that nonsense with insurance. How bad is the access gap right now, and how is Kay kind of fixing it and kind of getting into this picture?
Look, the access gap is bad and getting worse because it's very tough to become a doctor and it's easier to get pay as an investment banker, so high pay. So it's becoming less attractive. It used to be a high status job. I think it's, other jobs are becoming, you need to study much less and you can do much more. So I'm thinking right now in many parts of the country, it's weeks to see a primary care and months to see a specialist, even 6 months to see a specialist, especially neurology, cardiology. And, the way to resolve it is what we did. On our platform, the vast majority of cases, you'll be able to see a doctor within hours, same day for sure. And how do we do it? There's no magic. We're not cutting corners. The way we did it is most of the work is done by the AI, so the doctors can be much more productive, but they can also focus much more on the patient. They don't need to do the medical intake. They don't need to figure out a whole host of things about the patient's medical history. They don't need to interrogate the patients, all organized for them, and it's all integrated into a system of record. Epic is the most powerful system for workflow and billing, and we're integrated into that. So the ability to work there is critical. Get rid of all the back office, but the front office is where the issue is. There's a lot of companies, including ourselves, that do the ambient and back office stuff. But the front office is the top. When I say front office, I mean the aspects of triage, of diagnosis and treatment, and all those different jobs that need to be done.
That's a big kind of point that you brought up. Kind of going back, for founders listening, you've had unbelievable partnerships with Mount Sinai, Mayo Clinic, Hackensack, and you just mentioned these. What was the process of building trust with these partners at first, and then saying, look, K is actually going to solve a significant gap that you guys have in your health system. How did that process look like?
Look, it's a multi-year process. I don't want to scare anybody, but you can't knock on the door of Mayo Clinic or any major academic or community system and say, look, I got an AI model and I've got a doctor that will vouch for it. And here we did a test with 100 patients. No, we had to have a huge body of evidence. We built a system that was used across the continental US. We had a direct-to-consumer offering that was extremely popular. We were seeing thousands of patients every day. We built a 24/7 service system to take care of these patients. We built all these capabilities, and we showed a lot of evidence. And then we did multiple peer review studies with both Mayo Clinic and Cedars Sinai. We worked with Cedars Sinai, not with Mount Sinai, both equally fantastic institutes. And the reason that we could do that is because they believed that we built something outstanding. Yes, there were things that they thought we should do better, but they were curious about us as well, both Cedars Sinai and the Mayo Clinic. And that built us a lot of credibility. Look, if you're going to work in healthcare and you're going to try and innovate, whether the CEO is a physician or not, physicians have a ton of informal power, both specialists and primary care. So if you're building something, the best way to convince a doctor that your product's working is let them use it. Let them try and see if it works. Let them play around with them. Let them see real life patient cases that they can review, because the proof is in the pudding. Otherwise, you're a model that you claim you're working, but a patient, you know what people say, patients have not read clinical vignettes. They didn't go to medical school. They don't present their symptoms like the medical book. They're presenting the symptoms the way they are, and every person is a little bit different. So you need your AI to be battle hardened. AI has seen millions of patients in the real world and help doctors make diagnosis and treatment decisions in the real world. And we can track that and look at that. So that stuff is critical. And then everything you build, you're not moving fast and breaking things. You're moving fast to think, and you're moving fast to execute around things that work. So we need to be a trusted partner. Any partner we work, whether it's a big community system or a major academic system, they want to make sure that our medicine is good, first of all, that if we're using AI, they can trust our AI. That if we have a software bug, we're fixing it really quickly, that we're there for them. It's a 24/7 service. It's a 24/7 technology and medical services. So in order to do that, you need to get that. And it doesn't matter how good your technology is, if you can't work with them according to the way they work, can't do anything.
And one common problem a lot of early stage founders have is, should they start off with going B2B or B2C? And I know this is something that you've at K really worked on. Was you guys were B2C, and then you had a lot of B2B2C corners. How did you figure out, okay, we worked with consumers, and then we went to employers, we went to payers, and as well as health systems. How did you know you guys had to go that path as well as going to the consumer path?
Look, I don't view it that way. It was always our plan to work with your medical records, because that's just better medicine. And we wanted a full-blown primary care that's integrated into everything you're doing. So it was always our plan. And so, that's, as I mentioned, we need the credibility to be able to do all of that, which is not, not obvious. So that's what we built.
Going to the patient engagement front, I've previously built a startup in the kidney space, focusing on patients with chronic kidney disease, for example. How can you walk through how you've gamified or helped patients over time? Because engagement with patients is a notoriously difficult thing. How did you kind of work with patients over time and make sure you're making the product to their needs specifically?
How should I say this? I don't look at this as gamification. It's patient engagement. And so the magic here is much less than what you think. The magic here is being able to the magic able to talk to a patient around their health in a highly personalized manner. If I'm going to ask you intelligent questions, you're going to be able to engage. Because if you have a headache and I can talk to you about your headache or your rash, and I'm asking you questions and they're relevant, and it's like, yeah, I also have this, I also have that. These things that creates engagement because people have real intent, whether it's acute, chronic, preventative, they have a real reason. It's really important. And so I think that's what you do. The magic is to have a ready intelligent system. It's kind of like anything else that's personalized enough. You don't need to gamify it. I don't need to give them a prize in the end. I don't need to have them follow steps.
Yeah.
Patients have a high desire to resolve stuff. Often they come highly educated about this topic. It's important stuff.
My primary question was, I mean, you were the co-founder of Wix, and then you kind of came into healthcare. How did you kind of come into healthcare at first, and why go into healthcare in the first place?
Look, my dad had a stroke that I thought was preventable. And when I listened to the doctors post the stroke and whether they should put him back on Coumadin, a blood thinner, or not to avoid a secondary stroke, a repeat stroke, I felt like the decisions weren't personalized. I felt like they didn't have enough data in their fingertips. And that's what I wanted to build. I wanted to build a lot more sophistication, both for doctors and patients.
And kind of going more into, and I think this is a big kind of thing, is on the AI front. Your AI at K Health, I'm assuming, pulls in millions of anonymized records of insights. What is the single, I guess, biggest accuracy edge that gives you guys, I guess, a better check over like the competitors and helps with standard symptom checker?
Look, I don't know what a stand-up symptom checker. This is not a symptom checker. That's a complete way to understand patients, engage with them, figure out if they've got a clinical issue, figure out if it's an emergent condition that involves the ER, figures out the potential diagnosis treatment, puts it in front of a doctor with a history of present illness, allows a doctor to make decisions, who makes a back office. That doesn't sound like a symptom checker to me. It's like saying Google is a VLOOKUP table with or an AI is just one token after the other. Think that what makes K unique is the fact we've got a multi-year, multi-million people that have used our platform. Our platform has seen patients in the real world in health systems. There's nobody else that's doing that. People do stuff in imaging, people do stuff in other specialized area, but nobody does that at the core population health and core primary care, which is much needed if you want to fix the access, the quality, and cost of healthcare. The fact is you're getting a 24/7 service through all our hospital partners. And the fact is this service is available with the same insurance that you have. You're not paying extra. And you can get highly personalized medicine. You can get a primary care same day. I mean, it's a world apart. I don't know anybody who's doing any of those things. So there's, again, a lot of claims, and I'm sure we'll have competition. It's a massive market. By the way, competition is not bad, to be clear. There's a lot of people, there's not a lot, but there's a few people that are doing really interesting products with AI. I think we allies. I think we educate the market to the ability to use these sophisticated AI agents to drive better outcomes, to drive better, to lower costs. I think you're educating the market on what can be done. You're educating patients, you're educating doctors. So these things are allies. I think something's got to give. The current structure doesn't make sense. And I think it's going to change quite rapidly in the next few years. And hopefully we'll be part of it. But more important than the change happens.
Absolutely. So, a lot of times patients are very wary about AI as well. I mean, as long if you're not in San Francisco.
No patients worry about AI. People write about it because they want to write a vantage point about it. Patients use our AI all day long and love it. Doctors love it because it reduces their cognitive load. Patients love it. Patients also consumer, and they go all day long on ChatGPT and Claude and ask questions about their health. It doesn't strike me as people not liking it. I think there's 5 critiques that are sitting out there and want to write a book or podcast about the fact that patients don't want to use AI. It's a made-up story that's just not relevant. So the question as a premise is wrong. People love AI. This is a question you need to. Why do people love AI? Because they want to get answers to their questions, and they find that these frontier labs are highly intelligent. Now you want to integrate it to the fact that people also need medical advice. They need to use insurance. They need a prescription. They need a referral. They need a diagnosis. They need a follow-up. They need a specialist. And we built all these capabilities based on real world data on millions of patients we've seen. So I think that's the world that we want to do. I don't understand the need to protect the bureaucracy. You've seen there is a big study by Johns Hopkins that talks about, I think, 6% mistake in ER across America, and that's ER. It's easier to find mistakes in ER than in primary care. So you have an industry that's very expensive, that has a lot of access issues, that struggles to manage patients, not because people don't want to, because it's really, really tough. And now you can change the cost structure. You can unleash a lot of sophistication and intelligence and let people use it. I think there's zero people, aside from those that have a vested interest to protect the status quo, to not want to have AI. I think in 5 years, it would be crazy if you're a doctor and you don't have this built-in second opinion around taking care, how to take care of patients, the ability to follow up with patients. Like, it's a world apart. I don't know, when the first car came and people were in a horse and buggy, maybe they said, I don't know, this is a car, it's making noise, et cetera, et cetera. Trust me, nobody out there, I looked outside of my window here in New York, nobody out there is on a horse and buggy going from New York to New Jersey or Connecticut or to the airport. Nobody. Everybody's in the car. And so, yes, you can find two people say, I wish horses were around, but you can't get around with that. So
Yeah.
there is a big change that needs to happen. You
Yeah.
either let that tapeworm continue, or you figure out how to resolve it. And that's that's a mindset that needs to be. I don't think we need to always quote some naysayer sitting in the corner who doesn't even know what AI is.
Yeah, no, I agree completely. And the biggest way I was kind of going with that question is more on the trust layer. A lot of patients trust AI. The biggest question more is, do they trust the exact answers coming from AI as well? And I wanted to kind of learn how your patients in K are using AI to their favor to make it as beneficial for themselves. Because as you mentioned, and I think I'm completely with you here, AI is changing the world for the good for patients or for providers. How are patients using AI?
Our AI engages with patients around all aspects. Why are you here? What kind of information are you looking for? Are you looking for just information? Do you have an underlying clinical condition? Do you know? Is it a symptom? Do you have a lab result that you want to discuss? All these different things that people are going to ChatGPT and Claude and Gemini, etc. So we are part of that wave, except I've integrated into the health system and we built this. We're not a general purpose thing. You can't do general therapy. You can't have general questions about planet Earth. It's built to focus on health, which is a big chunk of your life. Health, broadly speaking, around nutrition, health, prevention, etc.
Right.
And so that is what we built. It's still work in progress. There's still a lot of pieces are coming. I think you asked a wonderful question, which is, how do you build trust? And the proof is always in the pudding. Doctors need to feel comfortable with it. The AI needs to work. Patients need to understand that the AI is not a doctor. They can't diagnose and treat you. We're very clear about that. But they also are looking for great information that's integrated. The fact that they can use our AI and then press a button and be in front of a doctor, it's a game changer.
Yeah.
It's not this triage dead end. Let's assume if you use one of the frontier labs, and again, not knocking them, I love them, I use them myself, and you put in some labs or some symptoms and it tells you this or that. Maybe it's right, maybe it's wrong. There's further tests or labs you need to do. It's not everything is always, again, a thaw throat with an obvious solution. So great. What do? Copy and paste it and put it in front of your doctor? Why don't build it in an integrated manner? Why not take into account your insurance? Why don't you grind it by your medical network? Why don't you enable somebody to be seen by a doctor right now? That's a vast difference from what exists today. That is typically oil and water. People used to go to Dr. Google, get referred to WebMD and other stuff. It wasn't as sophisticated as they are today, not by any stretch. And then what can you do? Nothing. This is not a telemedicine platform. It's an integration of all these pieces, and it's integrated also into brick and mortar and specialty. Now, have you finished to build it? No, but we'll get there.
And you brought up a great point there where it's very integrated, what K is very integrated in. It's pretty much something that can't be made by the large frontier labs.
First of all, I think they can. They can go and
I mean, they can't.
Hartford
They don't have
Hospital,
the
buy
trust.
hospitals.
They don't have your stability or trust that you've already integrated with all these health systems.
I get these things are not undoable. I just think they're really, really hard to do. And if you're running a frontier lab, maybe you're focusing on coding, maybe you're trying to secure GPU, maybe you're going public. There's a lot of things you're doing there that competes for your time and attention. There's no 1,000 people need to think about this thing. It's always a handful of people.
Right.
Building something in health or healthcare, whether it's for a payer or for provider or for devices, so you're competing with a lot of attention. Can a company like Google come and compete in this space?
Yeah.
Absolutely. I would never assume Google can't do it. They've got a lot of money, a lot of resources, a lot of capabilities, but building it right is not for the faint of heart. It's not an easy thing to do. Not like, oh, let's just walk and, because I'm a big name. So we partner with all these companies. I think we'll partner with many, many companies. I think there's such a opportunity here to impact lifespan and to take down costs that, this is not one company can do it. Even Google or Meta or OpenAI or Anthropic, they will also partner. And I think that's how it's going to work. So I wouldn't think about it as zero-sum game. I'm going to win. XYZ is going to win. I think there's room certainly for 2 or 3 major players. I don't think there'll be 20 or 30. There'll room for 2 or 3 major players. There's a whole global opportunity that I would focus on. But I think if we can build it right in the US with a Mayo Clinic, with Mass General, Brigham, with other major institutions, with Hartford HealthCare, those are the brands that everybody in the world wants to work with.
Yeah.
And so from there, we can go out of the US. But first, first we take Manhattan. You know that song?
That's a huge population too. You got big population there in Manhattan. So that's a big one. But you've had. I mean, one big thing is, and we've been talking about this. The whole theme of the pod is retention, trust is everything. What kind of metrics that you've stabilized on at K Health have proven amazingly to health systems and patients overall? Like what
How
metrics?
medicine works from a population health metrics, how we manage our doctors, how we work on our platform, how our AI works, their ability to use it. They look at metrics, but they also use the product. The proof is in the pudding because they want to see how we handle irregular cases, how we handle messy cases, how we move patients around. Do patients understand it? You can have the best model in the world and the best software and the best UI, but if a patient doesn't understand it, doesn't help. You can have the best model in the world and the patient understands it, but the doctor doesn't understand what was collected. Those things are critical. And then you need to focus on making sure you're making it efficient. You want to automate anything that the doctor should not be doing, any back office stuff, any collecting information, any detailed analysis. Those are the things we've done.
The last question then. Since the beginning to now, what was the unified, I guess, go to market that you changed over time since the
Access to
beginning?
high quality medicine. How can I use data and AI to access high quality medicine and build an intelligent software layer that helps manage patients? And my ideal partner is a health system that has your medical record and can give you the full gamut from primary care, urgent care, ER, specialty care, test labs in a single medical record. And so that was what we built. How did we do it over time? Like you trust anything in your life, it has to work. It has to work as advertised. It's not a gimmick. It needs to be there. If there's a problem, we fix it. Medicine is already complicated. Healthcare is complicated. People are in fear. They're in pain. It costs money.
Yeah.
All these different things. It's important. I'm just going to argue that medicine is really important. There's nobody who's got the worst headache in the world at 10 p.m. and says, let me just go to sleep. I'll think about it tomorrow. No, you can't go to sleep, first of all, and B, you're terrified, or you're in severe pain. So let's just remember what we're dealing with. We're dealing with this next to nutrition and shelter and, and basic employment is a core factor of people's life. That's why it's 20% of the economy.
Quick rapid fire here before we finish it off. Are you ready? Do it. What is the most overhyped trend in healthcare AI right now?
Most overhyped trend. Look, I think there is a lot of talk around ambient. It's quite a commodity. So, it's a lot of people do it, including us.
What is the best founder advice you've completely ignored?
Best founder advice that's a tough question. I need to think about it. The thing you have to grapple with all the time is focus.
No.
And
That's true.
focus is easier said than done. So sometimes, you want a parallel process because you want to accelerate your go to market. And sometimes you have to do less and do it well.
Absolutely. What is the single most common symptom people input into K Health right now?
There's no one. People have just the things you could think about. They have hypertension, they have high cholesterol, they have diabetes, they have upper respiratory infections, headaches, stomach aches, OBGYN and men's health, women's health stuff, Just think of like the obvious thing. Everything that's out there is on our platform.
2 more questions. Will primary care exist in 20 years?
Absolutely. it's going to be much more important, and it's going to be much more automated and much more intelligent and much more integrated into the health system at large. You might not even realize it's primary care. It could be your eyes following up with you on your vitals. It's going to be in between visits. It's going to be omnipresent, but ideally you just live your life. You don't think about it.
Final question, best advice you have ever gotten but did not listen to?
Like the best advice I would say that's really hard to listen to is that you only have a certain number of creative hours a day. You can't really work 14, 16 hours a day, 7 days a week and be at your best. So that's a really tough thing to do. But again, it's not a 9 to 5 job, and you need to do what you need to do. So you need to be able to use that adrenaline, make it happen, but also figure out a way how to store more and how to unwind, whether it's with friends or whatever you do, yoga, meditation, sport, walk,
Yeah.
hang out with your family, with your
What do you
kids,
like to do? What do you like to do?
all of the above. I love doing sport. I love hanging out with my family. I love hanging out with my friends, my dogs, hiking, being in nature. Being in nature is so good.
Yeah.
Anything that's analog is good if you're living in this high intensity, technology environment where you need to think a lot. You
Yeah.
know, your
It's just
brain's going to
simple.
think. It's just going to think by not thinking explicitly.
Yeah, just simple. Go outside. It can change. A 5-minute walk. But dude, it's amazing to have you on the show, and I enjoyed this so much. It was a pure joy. So thank you. I truly appreciated it.
Thank you, Satvik. And yeah, let's be in touch. Thank you.